State lawmakers were consumed this past week with days of hearings related to health reform, including a presentation from our previous guest, Governor Asa Hutchinson. I'm now joined by State Senator David Sanders and State Representative Michelle Gray for reaction and direction on where this health reform debate may go. Thanks to both of you for being here.
Thank you.
So what was your biggest takeaway from the governor's presentation on Wednesday of this week?
Well, one, I thought his delivery was good, and I think that if anybody sort of looked or approached sort of where we were in January and where we are now, I think there's been a lot of shifting. I mean, to the governor's credit, he said that this entire process is going to be a data-driven enterprise. It's going to be an information-based affair. It's going to, we're going to be driven by numbers, and there were some great numbers in terms of the private option this week. We also heard some disturbing numbers about overall Medicaid, and I think the governor set out some principles that he has been looking at, some of his advisors have been looking at. But at the end of the day, we're the ones that are sitting and deliberating over really what the direction is going to be. What's the policy going to look like? So there were there's certainly some things I agreed with. When you look at increased cost sharing, I think that's a good idea. When you look at potentially people paying premiums above certain income levels, I think that's good. There were some things I didn't agree with. I don't think we should.
We'll come back to those. Let me get Representative Gray on the record here. What was your takeaway from the governor's comments?
My takeaway was a lot the same as Senator Sanders. I applaud the governor for his effort and the amount of time he's put into health care reform and really wanting to push the envelope, so to say. I agree with Senator Sanders again that the delivery, it was a great delivery. I think he spent almost an hour, talking to us and telling us, he kind of told us where we've come from, how we got to where we are, and essentially we can't look back, all we can do is go forward. Yeah. We've got to save $50 million, by the year 2020.
Seems like billion.
It does, it might as well be. But $50 million in cost savings, which really equates to about $200 million in true healthcare savings by the time you get our
But it is a
share.
multi-billion-dollar program.
It is.
The governor's presentation skills to the jury from his lawyer days, I think, paid off big time in front of the legislature. Yeah. So in essence, he basically said you have three choices. You can kill everything, you can let the state fund everything, or you can do this Medicaid expansion with the federal government allowing for certain waivers. Was that your interpretation, and is that the path that you think that you guys will take?
That was the basis for my interpretation. Honestly, my basis was we're going to keep the private option, figure out how to make it work. That's how I took the speech, along with some of my other colleagues as well. So it's a tricky slope in that the people that support the private option and the people that don't, you have to try to bring them together so that we can all agree on some sort of health care reform.
Where are you on that?
Well, I don't agree with the Affordable Care Act from a philosophical standpoint, but I do understand you've got this bucket
of us here.
Really? You've got this bucket called uncompensated care and Medicare cuts from the federal government, and all they've done is shift that bucket into the Affordable Care Act, the premiums and the private option. So I do understand from a pragmatic standpoint, if I take that bucket totally away from the state, what it'll do to our hospitals. Our rural hospitals will close, the economic impact it would have on the state. So although I want to stand tough and say I don't support and I can't vote for this, I do understand what it will do to my constituents if I don't.
Senator Sanders, what do you think is a non-starter from the governor's perspective, of the 7 points that he laid out there?
I think when you look at part of the conversation we talked about on the income side, looking at putting people in fee-for-service, Medicaid as a way of, but I don't think that is not the end game for him in itself. He wants to encourage work, and I think that's great. Right. So I don't necessarily agree with that policy. That's what we've sort of developed the private option for. But I do agree with the notion that we have to encourage work. One of the things I said in committee this week is we have work requirements in existing social programs, in the SNAP program. We ought to remove those today. They can do that administratively. So that's one of them. And I'm a supporter of the state-based exchange, and let me tell you why. We've litigated the exchange sort of question, and the conservative legal strategy against the Affordable Care Act was to advocate for a federal exchange. Not a very conservative policy. Historically, states have been where insurance regulation has been managed, developed, and implemented. I think that's where we need to go, and I think it's better for us, and it does create more flexibility long term.
All right, to both of you, we got about 90 seconds left here. Is managed care going to be a component of all this, and how big of a component of all this?
I will go out on record right now saying that for the most part, I disagree completely with managed care. However, we had a lot of presentations given to us this week, and if I need to see the cost, I need to see the data, I need to see, there's no reason for us to reinvent the wheel on this. Other states have done it. Show me some hard numbers where you can show that this has saved money. They'll cut into that. You've got a certain amount of spend for health care, and they'll take their administrative costs.
Sure.
They have to be able to show that they can save at least that much plus more.
Robbie, the bottom
30
line,
seconds.
yeah, the bottom line is this. We have some massive problems with our existing Medicaid program. For the insiders, it's behavioral health, RSPMI, DDTCS, CHMS, all those acronyms, right. But the bottom line is money. It requires more and more and more money. And again, this is a $50 billion program. The private option is a small sliver. This is where the problem is. So I think, again, it's going to be a data-driven enterprise. It's going to be one that we look at numbers, and at the end of the day, when we begin our deliberations and begin shaping the policy, I think everything has to be on the table.
All right, Representative Michelle Gray, Senator David Sanders, thank you both for your time. Appreciate you.
Thank you.